My name is David Anthony. I have a PhD in counseling psychology, and I have an undergraduate degree in education and community counseling, and in my master's and my bachelor's degrees are in criminal justice and developmental psychology. But I've worked in the business, mental health business, and substance abuse business for 44 years. So I've seen a lot of changes that transpired over that period of time. My specialty or my primary focus is in PTSD, and I've worked with PTSD since the late 70s. So, and childhood trauma is part of that whole thing. So here at this hospital, we do trauma-informed therapy, or trauma-informed treatment, which is we assume that there's a trauma base to most things that we're going to see with the patients that present here, because it's an acute stabilization hospital. Anchor Hospital, because of where we're located, we deal with a large minority population here. Most of our folks that come in here that are not sent from emergency rooms outside of this, of the Atlanta area, are from the south side of Atlanta and the city of Atlanta. And so we do a lot of work with minority populations. Minority populations are overrepresented in the substance abuse field, but they're undertreated in the substance abuse field. So you're going to find that without having the income and without having the support systems and the capabilities to go and get treatment, that they're going to start using substances more and more. And the other part about it is it's more acceptable in a lot of the minority populations to use substances. So that's also a cultural change that we have to try to go through in dealing with that, because they simply don't have access to the type of mental health services that you would have in Alpharetta or Roswell or someplace Dunwoody, someplace like that. It's not there. You know, they have lower incomes. It's a socioeconomic situation here, and so we try to do what we can do to turn that around in some way. But we have a lot of people who come back in who are readmits over a short period of time. So it's also trying to deal with how do we deal with that. You know, how do we stop the readmissions? What do we do? But when we refer them out for follow-up care, you have transportation issues, you have housing issues, you have all these other issues that kind of impede that. And we sit right next door to a facility where if you have the money, you'll be in it for 18 months, and they have a high rate of success with that. But the population that we work with, and the general population, speaking in general population across the board, does not have that kind of income or that type of support to deal with it. So they want substance abuse to be treated with medications, and that's only a temporary fix. There are some anti-craving medications that are out there that can be used, and we can also treat some of the depression and that kind of stuff. But it's a lifestyle change. And a lot of times there's not the capability in the population that we serve. There's not a capability to move, pick up and move. You have your most success with people who can get out of the environment that they're in and get into an environment that's a little more healthy. And that's not to say that, you know, minority populations or minority neighborhoods and stuff are unhealthy. But if you're in the area where you know how to find the drugs, or you know where to get the alcohol, and you know how to do all that, you need to be someplace where you don't know how to do all of that and make it a little bit more difficult because of all the triggers that are out there. But you also, again, have to look at this from a cultural perspective. In the different minorities that we work with, for instance, most of them they want to hold in, or they want to keep it within the family or within the family systems. They're not really prone to go outside of that system. And sometimes the family system is as unhealthy as the patient that we're seeing here. And so you kind of got this catch-22 that's going on with that cultural aspect of it. Again, it's they will hold on, or they will try to deal with this internally in a family system and not seek help until they're at the point where they are 1013 here, or they go to an emergency room and are committed to the hospital.